So good morning. My name is Cassandra Glover, Health Policy Fellow at Arkansas Advocates for Children and Families, and I would like to welcome you to the launch event for our webpage, Medicaid, the Lived Experience, which is currently up on our website. For the past 5 months, we have been collecting stories from Medicaid applicants, enrollees, and providers to understand the strengths and opportunities for improvement within the Arkansas Medicaid program. We partnered with local community organizations whose work focused on historically excluded populations. Our amazing partners helped us to gather stories from the Marshallese, African Americans from the Delta and Central Arkansas, and the Latino Hispanic community. We went into neighborhoods and met face-to-face, over the phone, and via Zoom with Arkansans who informed us of how Medicaid has positively influenced their lives. They also discussed with us ways that Medicaid could change to help improve their access to healthcare services. The vulnerability of each storyteller who entrusted us with sharing their life experiences was inspiring. Some stories provided a sense of joy, some left us speechless, and some stories brought tears to our eyes, hopeful for the future of the Arkansas Medicaid program. I want to thank the Robert Wood Johnson Foundation and the Georgetown Center for Children and Families for providing our organization with the opportunity to engage in this story collection project. I want to thank our partners for helping us gain contact with Arkansans throughout the state. Thank you to the storytellers who shared their time, opened their hearts, and dug deep into their past and current life experiences with the state Medicaid program. Without you, this project would have been impossible to complete. Next, I want to thank the AACF team for their feedback throughout this project to ensure that we did our best to uplift and effectively share the stories of our fellow Arkansans. Thank you to Close Creations for helping to make our vision for the website come to life. Lastly, but definitely not least, I want to thank Dr. Danforth, Chair of the Management and Community Practice track at the University of Arkansas at Little Rock, whose coursework allowed for collaboration between our organization and 3 graduate students within the Masters of Social Work program. Without further ado, I want to introduce you to those 3 amazing graduate students who have aided in completing this project. Tasha Jeffries, Mikos Barbie, and Deidre Gray. These students have engaged in a community-based action project that has provided them hands-on experience to engage with our local community. They have been instrumental in contacting participants of the program and shaping the stories that you will read on our Medicaid, the Lived Experience webpage. Tasha, Mikos, and Deidre will be leading us through a presentation that will detail the social problem of access to healthcare, their connection to the community, and providing interventions to create opportunities for social change through policy recommendations. Thank you all for the work that you have done to make this project a success. And with that, I will go ahead and hand it to you guys.
Okay, thanks, Cassandra. That was a very nice introduction. My name is Deidre, and I'll just go ahead and get us started here. Just a little background. What is Medicaid? It is our nation's public health coverage program. Millions of Americans are covered by Medicaid health insurance. Those Americans include low-income adults, children, pregnant women, elderly adults, and people with disabilities. It's administered by the state according to federal rules, and it's jointly funded by the state and federal government. Numbers wise, nationally, 75.9 million people are covered by Medicaid. In Arkansas, 917,474 individuals are covered by Medicaid, and you can see that broken down by Medicaid and then CHIP insurance, which would be for children. Okay, so we did some research to kind of assess where we were currently as far as access to medical care goes. And here are some what we thought were useful little nuggets. So compared to uninsured non-elderly adults, Medicaid enrollees reported that they were more likely to have a usual source of care. They were more likely to have had a visit to a doctor in the past year. They were more likely to have had a specialist visit in the past year and less likely to have delayed medical care in the past year. Continuing on there, Privately insured non-elderly adults did report fewer barriers to care than Medicaid recipients. Some of the things that they mentioned were they were more likely to delay medical care because of concerns about out-of-pocket expenses. And Medicaid recipients were also more likely to have trouble obtaining appointments and less likely to have transportation. And this last point here, I think we'll all talk about this a lot. One of the other things that we found was that Arkansans are limited to 12 appointment slots throughout the year. And that's PCP, specialist, all visits are limited to 12 in a year. Okay, for children with Medicaid or CHIP, we did find that they had more difficulty than children with private insurance when it came to finding a doctor who accepts their insurance, making an appointment, and obtaining specialist care. So that was more difficult for children on CHIP or Medicaid than for children with private insurance. Children with Medicaid visited the emergency room more often, and their families were more likely to report that their usual medical providers were either not open or they didn't have a place to obtain care when they needed it. Lastly here, dental coverage, although we have seen a narrowing gap between privately insured children and children on Medicaid, there is still a gap. Children on Medicaid see the dentist less often than children with private insurance. And the 12 appointment slots, just to point that out again, that also applies for children. Okay, something else we discovered were some provider access challenges in Medicaid. It's really important for states to have enough doctors who see Medicaid beneficiaries so that they can get the care they need. We found that overall providers are less likely to accept new patients with Medicaid than those who have private insurance. We also found that it differed across specialties, but generally when physicians are reimbursed at higher rates, they are more likely to accept new Medicaid patients. Something else interesting that we wanted to point out, just having providers who accept Medicaid beneficiaries isn't necessarily a complete picture of access to care for people who have Medicaid. An office or a doctor may accept Medicaid, but they may be full on the amount of Medicaid patients that they accept at that time. And these are issues that we've seen across the nation, but it's definitely felt here in Arkansas as well. Okay, and I'm going to toss it over to my colleague, Mr. Mikos.
Okay, I'm going to speak on the importance to the African American, Latinx, and Marshallese communities. First off, I want to speak on the Marshallese community. That community has a high rate of infectious diseases such as tuberculosis and leprosy. They also have a high prevalence of cardiometabolic comorbidities such as type 2 diabetes and others. And they are also more, I guess they would be the ones who would be more low income. And for the African American community, they are more likely to be uninsured in America. And as we were doing research, we found out that the states with the largest populations of African Americans did not expand Medicaid. Of course, most of those were in the South, and when we're speaking on COVID-19 implications, the Black communities lost jobs at higher rates than any other community. Okay, for the Latinx community, Medicaid helps nearly half of the Latinx children and the African American children to get a healthy start on life using various programs aimed at children such as Our Kids, They have A and B. In 2018, 17.3 million Latin Americans were supplied coverage. This number accounts for nearly 1/3 of all the total Medicaid enrollees. During the previous administration, which was uh, previous President Donald Trump, Latinx families were resistant to apply for Medicaid for a fear of deportation or family separation. Okay, I believe I'm gonna pass. I believe it's Tasha.
You're muted, Tasha.
Hello, everyone. I'm Tasha. Sorry about that. These are the relationships with community members that we gathered. So, of course, Arkansas Advocates for Children and Families, Arkansas Medicaid recipients, especially the ones that we were able to interview, Arkansas Medicaid providers, medical facilities and nonprofit clinics, and nonprofits who recruited survey participants, Friends with Faith, 100 Families, Children's International, and Immerse Arkansas. So while doing these stories, and of course afterwards, Arkansas Advocates for Children and Families were able to come up with a strategy for change. These suggestions, of course, are meant to intentionally address the needs uncovered while collecting these stories for this project. So one was to collect stories from Arkansans to demonstrate the strengths and areas of opportunities within the Arkansas Medicaid system. The data collected will be used to inform policy proposals that will benefit children and families in Arkansas. It will also be used to help persuade individual Arkansans to support policies that increase access to Medicaid health insurance. The repository of Arkansas Medicaid stories will be hosted on a web page within the AACF website. Anyone who visits the website will be able to read, listen, or view various Medicaid stories along with specific recommendations for change. Based on the input from storytellers, the following suggestions for change are presented. Presumptive eligibility for children and pregnant women, 12-month postpartum coverage for new mothers to address the maternal mortality and morbidity crisis in Arkansas, increased appointment, prescription, and transportation slot allotments to improve access to medical care, improve processing of individuals within the Marshallese community, contracting with community providers in the Marshallese community to aid in processing applications to avoid application delays and problems with communication between agency and community members. Dental coverage for all Medicaid recipients with an increased allotment of coverage. And lastly, increased SNAP allotment for low-income adults, older adult populations with subsidized housing. Okay, I will pass it over to Deidre.
Thanks, Tosh. Okay, so for our program evaluation of this strategy, we'll look at two different things. First, engagement on social media and the website. So we want to know how many clicks the website is getting, and we want to see how many people are actually engaging in the stories. And then we would love to see policy changes from this project. A goal of the project was to humanize Medicaid participants so that hopefully when something is available to vote for that will extend coverage, increase access to coverage, that we would see a policy change there.
Okay, so how will this project that we embarked on be helpful? Well, as Deidre previously stated, it would humanize the Medicaid recipients. It would show that these are actual people who have, from all walks of life, different demographics, and things like that. We want to show that they are actually people who have a voice. We want to give them a voice. Okay, and we want to find gaps in services so that they can be addressed via policy changes. I think we're going to speak on that a little bit more later, but we do want to find the gaps because, you know, it's a lot of things that the recipients said that could be improved as far as, you know, access to services and transportation and things like that. Okay, we want to recognize resilience among communities. Okay, that is a big one. And number four, we want to engage community members to advocate for change within their communities. After all, the community members are actually the ones who would know more about their community and what, you know, what problems or issues that need to be advocated for. So that's why we definitely would want to engage the community members to advocate.
Tasha, I think you're muted again.
Sorry about that. What we would do next time, different next time. We would seek more meaningful connection with communities across the state to increase participation from specific groups. Those specific groups are the Marshallese community, African American community, and Latinx community. Quality versus quantity is the next one. So fewer stories that clearly depict the impact of Medicaid coverage. And lastly, think creatively about incentives. So we would give out incentive awards after the entire story is complete.
Well, I guess I will speak on the valuable learning since my name is first. The most valuable thing that I learned is that these issues are not just present in one population, but across all populations. Uh, the different issues that the recipients had were echoed by many of my participants. Issues such as transportation or the slots, things like that. Another key thing I learned that there's a limit on how many times the recipients of the Medicaid program can see doctors and specialists. This is something that, coming from my older participants, my older participants, senior citizens, this is something that they really have a problem with.
That was good, Mikos. So I think coming away from this project, I have a renewed appreciation for how valuable Medicaid is to so many Arkansas families. There was one story of a single dad who was hit by another car. He had his daughter in the car with him, and they had to be rushed to the emergency room. And he was just so grateful for having Medicaid to take care of what they needed to get healthy. He knew that that ambulance ride was going to cost $1,000, and that's before you even get to the hospital. So just those day-to-day moments that happen that can really burden families, Medicaid has been able to step in and help people just get what they need.
Okay. Last is me. I learned a lot about with just going through this experience, especially with parents that have children on Medicaid and speaking to individuals that have Medicaid that are disabled. Some of them experience the same issues and some of them experience different issues, but the main issue was with the 12 slots. Another issue is specifically with a mother that I spoke to over the phone. Her son is 14 years old. He's autistic, aggressive, but and nonverbal. She's had a hard time finding providers within the network. And by the time she was approved for, you know, Medicaid, she was opted out. So the issue with the 12 slides, they would have to use these slides if they, during the pandemic, if they had COVID, plus special visits, follow-up visits, sick visits, ER visits. So that with the 12 slots has greatly impacted these families.
Great job, you guys. And I do want to highlight, since we brought up the importance of community voice and making sure that we empower communities to advocate for themselves. Recently, within the last 2 weeks, we found out that the Arkansas Medicaid program is going to have a client voice council. So one of the goals of our organization is going to be connecting some of these storytellers to apply to be a part of this council so that their voice can be heard. We want to make sure that everyone within the Medicaid program is aware of these issues, but also that the community is able to advocate for themselves and the needs for their families. I do want to ask the students a few questions, and you guys can just, unmute and answer. If you had the opportunity to speak with the Arkansas legislator, what health policy initiatives would you advocate for to better serve Arkansans based on either personal experiences or due to the Story Collection Project?
I'll go first. I think definitely the 12 appointment slots that came up a lot in a lot of our stories. There are several conditions that require going to the doctor more than 12 times a year. So I feel like that's a really tangible policy change that would help a lot of people in a lot of different situations.
I agree with Deidre. The 12 slots, I heard that from multiple families. Just, if they just had more slots available for them for ER visits. I had one person even tell me, what about having slots just for emergency visits, especially during the pandemic. The pandemic, it didn't change anything so far as opening up more slots or anything. Families were having to use those 12 slots along with, physical therapy visits or just going to their primary care physician. And if they caught a common cold, they had to use their 12 slots. And some families were not able to go to the doctor because of them having COVID or a common cold, and because they were trying to save their 12 slots. So if they had 6 slots left and they caught COVID, some people were just trying to medicate at home or do whatever they can in order to save those slots. So I think I would like to have more slots available for those families.
Well, I echo that when they saying about the slots. I would, that is something that is a pressing issue amongst most of the recipients. I would also want them to look to see if there was a way that they could maybe get the doctors and the specialists to just see the patient at one time instead of going to different places. Something like they do the video health, they do things like that. Maybe they could come together and instead of the person having to go see 5 or 6 different specialists, that they maybe could have something like a care team where they could collaborate and come together, and the primary care doctor relays the messages or let them know what's going on. I think that would ease up on running out the slots real fast.
I agree. And I wanted to add something too. One of the things I noticed, one of the issues that has become relevant because the Marshallese community in February, adults have gained access to having Medicaid. And I've noticed that one of the issues, at least that the Arkansas Coalition of the Marshallese was seeing, is that people are applying, but the wait time is a lot longer because of the language barrier and communication. So somehow coming up with some type of strategic plan to maybe engage even the Arkansas Coalition of the Marshallese in helping to process these applications or developing some type of contract so that these applications can be expedited. And also too, looking at SNAP within SNAP rules and regulations and helping to expand that for the Marshallese community. The next question I have is, what stories do you feel impacted you most during your interactions with community storytellers? I know we've touched on that a little bit, but were there any other highlighted stories that really stood out to you that you would like to speak on?
Well, I had a guy who was turned down for Medicaid, but it actually, in his opinion, it helped him, it benefited him more than it hurt him, because he was diagnosed with kidney cancer by a physician, and he didn't believe it, so he went and got 2 or 3 more opinions, and come to find out, on the third opinion, they found out that it wasn't cancer, that it was something like a cyst, and he could get that handled real fast. But he went on to tell me that had he had Medicaid, he figured that they would have went ahead and took his kidney out, because when you have Medicaid, the doctors are faster to do those quick, to do those, surgeries or whatever on you, so they can, get that Medicaid money coming in. And he figured that had he had the Medicaid, he would be without a kidney, because he was born with 1 kidney anyway. So he thinks that by him not having the Medicaid, it actually helped him to go see other doctors to get other opinions, and he figures it kept him alive.
And were there any other stories that we'd want to highlight, Deidre, Tasha?
Yes, I have one. I spoke to a mother who lost her 19-year-old son last year. And one of the issues that she is having, amongst many others with Medicaid, is the delay in response. She never knew if he was approved for braces. To this day, she still doesn't know if he has been approved for braces. And that was one of the main things she talked about on the phone was, I just want to know if my baby was approved for braces, even though he's deceased. She has been diagnosed with, let me get this correct, PTSD, bipolar, severe anxiety disorder, and severe panic attacks, and also high blood pressure. And so she, because of the 12 slots, she needs to see the physician, but if she sees different physicians for every issue that she has, she will be out of her slots in a heartbeat. So that was another issue. And also her children need grievance counseling, and she has not been able to find a provider or special physician that is able to help with that in Medicaid. So no one has communicated to her who's able to help her with that, with the type of insurance that she has. So that was one of the main stories that stuck out to me.
And Tasha, you brought up a good point that made me also think of, the historically excluded communities that we focused on, the Marshallese, African Americans, and also the Hispanic Latino community have higher rates of health disparities. And like you said, co-occurring conditions, whether that be, could be diabetes or heart disease, or mental health. And just a lot of conditions. And so also seeing, I talked to some people who said, I get that they have a standard 12 slots, but what about people with multiple conditions? So we have to take into account that some of these communities have higher rates of disparities, and how are we going to help to make sure that they have access, regardless of the amount of conditions that they have.
Absolutely, because like she stated, I have to pick and choose which condition I'm dealing with the most. She also has some issues with her tendons. She's had surgery before, so that just adds on top of the other issues she's having, just with the PTSD from her son being killed, and just a long list. So I totally agree, Cassandra.
And Deidre?
Yeah, so I talked to a young mom who had an infant under 1, and they were born with chronic infant osteoporosis. And she was sharing with me that when her baby was born, was on Medicaid, was able to go to therapy. She was noticing a lot of improvements, but it was unexpectedly terminated, her coverage for her child. And so she had to go back and forth with the office for several months, noticing all the while that her infant is, going backwards on any of the progress that they made. So after a few months, she was able to get it reinstated, and her infant's now back in therapy and is doing well. But just if we had that eligibility for mothers and children, under a certain age, that whole thing could have been avoided for that family.
I completely agree. And I will share one story that has kind of really stuck with me throughout this collection process. A woman who has, and if you guys are watching, I would love for you to read Candace's story. A woman who was diagnosed with ovarian cancer. She said that because of things that had been going on in her life, she hadn't really been keeping up with her health. She got sick. She had fallen out one day. They were able to call the paramedics. When she got to the hospital, they didn't know what was wrong. She had no knowledge of anything about cancer, being in her body, but they were able to diagnose her with ovarian cancer. She was able to receive all the chemotherapy treatments at the, Medicaid paid for her treatment, paid for her stay in the hospital. She was there almost an entire month, I believe, or it could have been a few months. Read the story and you'll have accurate information. But it happened last year, and it was life-saving to her. But some of the issues that she's facing now is because of her multiple conditions, not the cancer, but her other multiple health conditions. She's having issues and difficulties with paying for her prescriptions. She is having to pay so much out of pocket, and she has a fixed income. And so it's made it very challenging for her, kind of going back to what Tasha said, picking and choosing what medication am I going to get. And if you read through the stories, you'll see a lot of people are facing that. Which prescription am I going to get this month? Which one do I need the most? Or even Medicaid may be covering a prescription at one time, and then it being taken off the list of prescriptions that they'll cover. So then, they're having to switch a medication for something that may have worked for the condition before. And now they're having to either switch to one or try multiple to do what one medication was doing before, but now Medicaid just isn't covering it. But my next question is, what community voices do you feel need to be included for future storytelling projects to ensure that all Arkansans' voices are heard?
I would like to hear more. I did interview a mother again that had an autistic son. I would like to hear more from that community, just parents that may be affected by the PASS program, because which is involved with Medicaid. But she is having a hard time once again finding therapists or physical therapy, different psychiatrists that will accept him just due to him being aggressive and nonverbal. It was one point in time where he was seeing a physical therapist, and because of him being aggressive, which is how he communicates, they had to drop him just due to his behavior. And of course, as she quoted, "I'm here for help. So if you can't help me, who can?" So I would like to hear more just from parents within that community.
I'd be interested to hear more from young people who age out of foster care. I know most young adults, youth have it while they are in care, and then when they transition out, it can get a little murky for them, how their coverage continues to work.
Well, I was thinking about the children aging out of foster care, but I would like to hear more from those who are incarcerated or those who are recently released from incarceration. I want to know what type of challenges do they face coming out of an institution and getting health insurance or being able to get appointments, because a lot of times when they're let out, they don't have transportation, they don't have a lot of things that people who have been not in an institution would have. So I would like to hear more from them so that way we, have a somewhat complete story of the Medicaid recipients.
Well, thank you so much for your feedback on those questions. Thank you for joining today for the launch of our Medicaid, the Lived Experience webpage. We hope that you take time to read the experiences of those who have been impacted by the Arkansas Medicaid program. There's opportunity for growth within the Arkansas Medicaid program and continued efforts to advocate for the following policy recommendations. Presumptive eligibility for children and pregnant women, 12-month postpartum coverage for new mothers to address the maternal mortality and morbidity crisis in Arkansas, increased appointment, prescription, and transportation slot allotments to improve access to medical care, improved and expedited processing of individuals within the Marshallese community, contracting with community providers in the Marshallese community to aid in processing those applications to avoid delays and aid with communication barriers, dental coverage for all Medicaid recipients with an increased allotment for coverage, and increased SNAP allotment for low-income adults and older adult populations with subsidized housing. This is just the beginning of our work to continue to push for policies that meet the needs of those throughout the state. We hope that you will utilize the information presented to advocate for our fellow Arkansans. Thank you for joining us this morning. Thank you to Mikos, Tasha, and Deidre as well for taking time out to present to our community. And we look forward to hearing about how the stories shared on our new webpage impact your lives and the work you engage in. Thank you.